Hey there, everyone, and welcome back to our health channel, where we dive deep into keeping you vibrant, strong, and thriving, especially if you're over 60. Today, we're tackling something that might catch you by surprise, but I promise it's going to be eye-opening and empowering. There's likely something sitting in your fridge right now, something you've been told your whole life is healthy, that could be quietly raising your risk of a stroke while you sleep. No chest pain, no flashing warning signs, just a silent shift in your body that could change everything. One moment you're fine, enjoying your evening routine, and the next, you might wake up struggling to speak, unable to lift your arm, or fighting to keep your balance. As a brain doctor who's worked with seniors for decades, I've seen this happen far too often, and not because people were smoking or eating junk food, but because they ate a vegetable. Yes, a vegetable! I know it sounds wild, but stick with me. Certain vegetables, when eaten at the wrong time or paired with common medications, can spark a dangerous chain reaction in an aging body. We've all heard the advice to eat more greens, that vegetables are nature's medicine, but what no one tells you is that for older adults, some of these so-called healthy foods can increase your risk of brain bleeds, blood clots, or sudden blood pressure spikes. Today, I'm going to walk you through 9 common vegetables that could quietly harm your brain, and more importantly, I'll share how you can eat smarter without giving up the foods you love. Trust me, the last vegetable on this list is one most seniors eat every single week, and it might be the most dangerous of all. Before we dive in, if you're new here, I'd love for you to hit that subscribe button and tap the bell so you never miss a health tip tailored just for you. And if you find this video helpful, drop a 1 in the comments. If it's not quite hitting the mark, let me know with a 0, so I can make content that serves you better. Let's get started with our first vegetable, spinach, the two-faced friend of your brain. Spinach has been hailed as a superfood for decades, and for good reason. It's packed with iron, magnesium, and fiber, making it a staple in salads, smoothies, and senior meal plans across the country. But here's the shocking truth. For older adults, especially those over 65, spinach can become a hidden threat if eaten at the wrong time or in the wrong way. As we age, our blood vessels lose their flexibility. Arteries that were once soft and pliable start to stiffen, and when you add in common medications like calcium supplements, vitamin D, or blood pressure drugs, the balance in your bloodstream becomes incredibly fragile. Spinach is loaded with oxalates, a naturally occurring compound that binds with calcium in your body. In younger, healthier people, these oxalates usually flush out without much trouble. But in older adults, particularly those with reduced kidney function or who take high doses of calcium or vitamin D, oxalates can start to build up, forming calcium oxalate crystals in the bloodstream. These crystals don't just affect your kidneys, they can harden the small, sensitive blood vessels that feed your brain, increasing the risk of microclots. These tiny blockages can cut off oxygen to brain cells over time. And if one shifts just slightly, it can trigger a full-blown ischemic stroke, the kind where you wake up unable to say your spouse's name or lift your arm. Let me tell you about one of my patients, Harold, a 76-year-old retired firefighter from Milwaukee. Harold was the picture of discipline. Every evening, he'd make himself a spinach salad with a sprinkle of feta and a slice of whole grain toast, paired with his calcium and vitamin D supplements to keep his bones strong. He thought he was doing everything right. But one winter morning, his wife found him slumped over the kitchen table, his coffee spilled, his words jumbled. He'd suffered a silent stroke overnight. No chest pain, no headaches, just a sudden loss of speech and motor control. His scans showed vascular calcification, stiff, narrowed arteries in his brain, and his blood work revealed elevated calcium and oxalate levels, a dangerous combination. The likely trigger, his nightly spinach salads, combined with his supplements over months, had created the perfect conditions for a blood clot to form in just the wrong place. cutting off blood flow to part of his brain. Harold survived, but he no longer drives and needs assistance to walk. With tears in his eyes, he told me, "Docs, I was just trying to do the healthy thing. I didn't know my salad could hurt me." It's a heartbreaking reminder that even good habits can turn risky if we don't adjust them for our age and health conditions. So, here's what I want you to take away if you're on calcium or vitamin D supplements, or if you have kidney or heart issues. Limit spinach to the morning hours, and only after checking with your doctor. Don't pair it with supplements, unless you've got medical guidance, and never assume more greens always mean better health after 65. If this surprises you, hold on, because the next vegetable might shock you even more. It's one praised for heart health, but can cause your brain to bleed instead of clot. Let's talk about broccoli. If you're still with me and finding these insights helpful, drop a 1 in the comments to let me know you're here. Broccoli is the poster child for healthy eating. Growing up, we were all told to eat our broccoli. It's rich in fiber, antioxidants, and vitamins, and it's fantastic for reducing inflammation and supporting heart health. But for many older adults, especially those on heart medications, broccoli can quietly become a risk factor for a brain bleed. It's not the broccoli itself, it's what's inside it, and how it interacts with your aging body, and the medications so many seniors take daily. Broccoli is high in vitamin K, a fat-soluble vitamin that's crucial for blood clotting. In younger people, this helps heal wounds and prevent excessive bleeding. But for seniors on blood thinners like warfarin, Plavix, or even aspirin, vitamin K can throw off a delicate balance when consumed in high or inconsistent amounts. It can make your blood too thick or too thin, and you might not feel a thing until it's too late. Let me share the story of Clara, an 82-year-old retired schoolteacher from Pennsylvania. Clara was meticulous about her health, faithfully taking her medications and steaming a bowl of broccoli with olive oil and lemon every evening. "It keeps my heart young," she'd say proudly. But what she didn't realize was that her daily broccoli was slowly interfering with her blood-thinning medication. Her INR, a measure of blood clotting, started fluctuating dangerously. One afternoon, after a mild headache and sudden confusion, Clara collapsed in her living room. At the ER, scans showed a hemorrhagic stroke, bleeding inside her brain, not from trauma or high blood pressure, but because her blood had become too thin to clot properly. When her daughter mentioned the broccoli, my heart sank. Not because broccoli is bad, but because even something healthy can tip the balance in a fragile body when misunderstood. Clara survived, but she now uses a walker and her speech is slower. She shares her story with her community, saying, "Don't assume healthy food is harmless, not at our age. If you're on blood thinners, you don't have to avoid broccoli, but you must eat it consistently and talk to your doctor." Sudden changes in vitamin K can make your medication ineffective, leading to clots or bleeds that could steal your independence in an instant. Aging blood vessels thin and weaken, so a small bleed that might be manageable in a younger brain can mean permanent loss of memory or speech after 70. If you're eating broccoli regularly and you're on blood thinners, get your INR checked regularly, track your diet, and never assume a healthy food works the same for everyone over 60. But if broccoli's got you rethinking your dinner, wait until you hear about the next vegetable. One that seems harmless but can dehydrate your brain overnight and throw off your blood pressure while you sleep. Let's move on to romaine lettuce. If you're over 65, you've probably been told that a salad for dinner is a smart, healthy choice, light, low-calorie, easy on digestion. It makes sense, especially when you're focused on weight management or heart health. But here's a truth most seniors never hear. That innocent bowl of romaine lettuce at night might set you up for a stroke by morning. Romaine is rich in water and fiber, but it's also a natural diuretic, meaning it encourages your body to eliminate water. In a young, hydrated person, this is barely noticeable, but in older adults, Especially those on blood pressure medications or diuretics, this gentle water loss can tip you into dehydration, particularly overnight. Dehydration in seniors isn't always obvious. You might not feel thirsty or notice a dry mouth, because your body doesn't send the same thirst signals it did when you were younger. Your blood vessels rely on proper hydration to stay open and flexible, carrying oxygen to your brain. When you're dehydrated, even mildly, your blood thickens, moving like syrup through fragile, aging vessels. This can lead to small clots, especially if you're prone to conditions like atrial fibrillation or vascular disease, or if you're on multiple medications. These clots might not cause pain at first, but one wrong move, a shift in blood pressure while you sleep, can lodge a clot in your brain, cutting off blood flow instantly. That's what happened to my patient Leon, a 75-year-old retired factory worker from Indianapolis. Leon was in good health, took his blood pressure meds, and ate a big romaine salad every night with cucumbers and vinegar dressing. He skipped heavy meals and stayed active, but one morning, his wife found him confused, struggling to speak, his right arm weak. He'd had a mild stroke overnight. His labs showed mild dehydration, increased blood viscosity, and electrolyte imbalances, enough to trigger clot formation. From his hospital bed, he said, "I thought I was being healthy. I didn't think lettuce could do this." It's more common than you think, especially when nighttime salads are paired with blood pressure pills or low-sodium diets that already reduce fluid retention. Romaine isn't evil, but in the wrong context, it can be the tipping point. Your body at 70 isn't the same as it was at 40. Small fluid losses from diuretic foods or medications can change your blood chemistry enough to make it clot more easily, and your brain is the first to suffer. If you love your nighttime salads, shift them to lunch, drink plenty of water, and be cautious if you're on medications that pull fluid from your system. Leon recovered after months of therapy, but he wishes someone had told him that even healthy foods have rules when you're older. If this is making you nervous, it should. But it's about awareness, not fear. Next, we're talking about a vegetable that seems sweet and harmless, but can spike your blood sugar and disrupt blood flow to your brain while you sleep. Let's talk about raw carrots. At first glance, raw carrots seem like the perfect snack, crunchy, naturally sweet, low in calories, and packed with beta-carotene for vision health. Many seniors keep them in the fridge as a guilt-free treat, something to nibble on while watching TV or as a healthier alternative to chips. But here's what you might not know: raw carrots, when eaten at the wrong time or in excess, can quietly disrupt your brain's blood flow and raise your stroke risk overnight. It's not the carrot itself, it's how it affects your blood sugar and insulin, especially after 65. Raw carrots, while lower on the glycemic index than processed sugars, deliver a fast-acting carbohydrate load when eaten alone and uncooked. In younger adults with strong insulin sensitivity, this isn't a big deal, but in seniors, especially those with pre-diabetes, type 2 diabetes, or compromised circulation, even a modest blood sugar spike at night can start a dangerous chain reaction. When you eat a handful of raw carrots before bed, your blood sugar rises quickly, prompting your body to release insulin to bring it down. But in many older adults, insulin responses are slower or overly aggressive, causing blood sugar to crash during the night, a condition called nocturnal hypoglycemia. This crash triggers stress hormones like cortisol and adrenaline, which tighten blood vessels, raise blood pressure, and make your blood more prone to clotting. In a brain with narrowed or stiff arteries, this can lead to tiny clots forming in cerebral vessels, setting the stage for a silent stroke or a transient ischemic attack (TIA). That's what happened to my patient Leia, a 78-year-old retired nurse from Portland. Leia was active and proud of her healthy habits, swapping sweets for raw carrots as her bedtime snack. But she started waking up feeling off, mild confusion, dizziness, tingling in her hand. She brushed it off as aging until one morning she couldn't remember how to make coffee, a routine she'd done for 40 years. Her husband rushed her to the ER, where she was diagnosed with a small stroke caused by blood sugar fluctuations and vascular spasms overnight. Her labs showed inconsistent glucose patterns and early insulin resistance, with scans revealing micro-clotting in her brain's tiny arteries. "I never imagined carrots could hurt me," she whispered. "If you love carrots, don't panic, but be smart. Don't eat them raw and alone before bed. Pair them with protein or healthy fat during the day, like hummus or a boiled egg, to blunt the sugar spike. And if you're on medications for blood sugar, blood pressure, or cholesterol, talk to your doctor about your evening snacks." Leah recovered, but her confidence in her routine was shaken. She now warns others in her community about innocent habits that could cost you everything. But carrots aren't the only vegetable hiding a risk. Next, we're diving into one considered medicinal in many cultures, yet it can thin your blood so much that a single vessel rupture could change your life overnight. Let's talk about garlic. Garlic is often called a miracle food, used for centuries in traditional medicine to lower blood pressure, reduce cholesterol, fight inflammation, and boost immunity. Many seniors add fresh garlic to their meals or take garlic supplements, believing they're giving their hearts a boost. But for older adults, especially those on blood thinners, aspirin, or heart medications, garlic can become a dangerous trigger for brain bleeding. A single clove might seem harmless, but it can tip your blood from protection to peril in ways you won't feel until it's too late. Garlic is a potent natural anticoagulant, preventing blood clots, which sounds great, until you pair it with medications like warfarin, Plavix, Xarelto, or even low-dose aspirin. This can push your blood into an over-thin state, and for seniors with fragile brain vessels, that's catastrophic. Let me tell you about Thomas, an 81-year-old retired railroad engineer from Missouri. After a minor heart procedure, Thomas was on a blood thinner and told to avoid dangerous interactions. But he'd read online about garlic's healing powers, and started taking a 600 IU garlic supplement daily, plus a raw clove in his dinner. He didn't think it mattered enough to tell his doctor. 3 weeks later, he began experiencing severe headaches, light sensitivity, nausea, and slurred speech. By the time his wife got him to the hospital, he'd suffered a hemorrhagic stroke, a brain bleed. His scans showed a ruptured vessel that should have held, but his blood was too thin to clot. The culprit, the garlic, combined with his prescription, had tipped the balance. "I was just trying to help my heart," he said weakly. Aging blood vessels are more fragile, more likely to rupture when clotting is impaired, and garlic, especially in supplement form, is far more concentrated than what you use in cooking. If you're over 65 on anticoagulants, or have a history of strokes or TIAs, talk to your doctor before using garlic supplements. Watch for signs like bruising, dizziness, or unexplained headaches, and don't assume natural means safe. Thomas returned home but needs daily assistance and has lost some short-term memory. His story is a reminder that good intentions can go wrong without guidance. But garlic isn't the only kitchen staple to watch out for. Next, we're talking about a vegetable so common it's in almost every pantry, yet it can disrupt your heart rhythm, steal your balance, and trigger brain fog or dizziness. Onions are a cornerstone of American cooking, from stews to salads, flavorful and full of heart-healthy compounds. Many seniors use them daily, believing they're making a wholesome choice, and in moderation, they're right. But for older adults on blood pressure medications or managing heart conditions, onions can quietly become a brain risk, causing unpredictable blood pressure drops, oxygen deprivation, and even clot formation. Onions contain quercetin, a powerful antioxidant that acts as a natural vasodilator, opening blood vessels and lowering blood pressure. That's great, unless you're already on meds doing the same thing, doubling the effect and risking hypertension, an unsafe drop in blood pressure, especially at night when your body is most vulnerable. Low blood pressure reduces oxygen and nutrients to the brain, triggering vasoconstriction as your body tries to protect vital organs. This rapid narrowing can cause clots in already narrowed arteries. My patient George, an 80-year-old retired football coach from Georgia, learned this the hard way, on a beta blocker for high blood pressure. He ate a raw onion salad every night to boost his heart health. At first, he felt great, but then came morning lightheadedness and dizziness. One evening, he blacked out, hitting his shoulder. The next morning, he couldn't remember the day and slurred his words. A small ischemic stroke had struck, caused by a clot in a brain vessel. His blood pressure showed overnight drops followed by morning surges, worsened by his onion, heavy diet and medication interaction. George recovered with therapy, but can't drive and struggles with names. "I didn't know I was starving my brain," he said. Onions can be part of a healthy diet, but if you're on heart meds, large amounts, especially raw and at night, can cause dangerous pressure dips. If you're waking up dizzy or foggy, talk to your doctor and track your diet. Next, we're diving into a breakfast staple that's sweet and golden, but can spike your blood pressure and disrupt your brain's rhythm. Corn is comfort food for many. Whether it's corn on the cob, grits, or stirred into soup, it feels safe and familiar. But for seniors, especially those with insulin resistance, high blood pressure, or vascular issues, corn can raise your stroke risk while you sleep. Though it's a vegetable, corn behaves like a starch, rich in sugars that quickly convert to glucose. Eating it at dinner or before bed causes a rapid blood sugar spike, followed by an insulin release that's often sluggish or overly aggressive in older adults, leading to a nighttime sugar crash. This triggers stress hormones that constrict blood vessels and raise blood pressure, creating a perfect environment for micro-clots in the brain. My patient Darlene, a 77-year-old retired librarian from Iowa, loved her morning corn grits and evening corn on the cob. She started feeling tired and dizzy in the mornings, with erratic blood pressure. One morning, her husband found her unable to move her left side. A minor ischemic stroke had struck overnight. Tests showed elevated glucose, thickened blood, and microvascular damage linked to her corn-heavy diet disrupting her glucose balance. "I thought I was eating like my mother did," she said tearfully. "If you love corn, don't eat it alone or before bed. Pair it with protein and avoid it late if you're diabetic or on blood pressure meds." Darlene recovered but learned that what's harmless at 40 can betray you at 75. Next, we're talking about a vegetable praised for its detox power, but capable of draining your body overnight and destabilizing your circulation. Asparagus is elegant and light, a staple in heart-healthy diets, but it's a natural diuretic that can dehydrate you, especially at night. In seniors on blood pressure meds, diuretics, or blood thinners, this can reduce blood volume and thicken blood, increasing clot risk. As we age, our bodies struggle to regulate hydration, and blood vessels become fragile. Asparagus's diuretic effect pulls water from your bloodstream, shrinking blood volume as you sleep. This thicker blood can form clots in narrowed arteries, silently traveling to the brain. My patient Joanne, a 79-year-old from Colorado Springs, loved her nightly steamed asparagus. On blood pressure meds and with mild atrial fibrillation, she didn't drink much water at night to avoid bathroom trips. One morning, she woke confused, slurring her words. A small ischemic stroke had struck. Her blood was too concentrated, worsened by asparagus and her meds. "I didn't know I was draining myself dry," she said. If you enjoy asparagus, eat it earlier in the day, hydrate well, and avoid pairing it with diuretics without your doctor's okay. Watch for signs like dry mouth or dizziness. But the final vegetable might be the most unsettling. It's in every kitchen, praised for heart and skin health, but it can mimic a stroke's symptoms. Tomatoes are a symbol of freshness, sliced into salads or cooked into sauces. They're high in histamines, tyramines, and solanine, which can trigger inflammation, elevate blood pressure, and irritate the nervous system in seniors. Their acidity can disrupt magnesium and calcium balance, critical for nerve and vascular function. This can cause dizziness, headaches, slurred speech, or numbness, symptoms mimicking a stroke. My patient Geraldine, an 83-year-old from Charleston, loved her nightly tomato soup. One morning she woke with blurry vision, a headache, and slurred speech. Scans showed no clot or bleed, but elevated inflammatory markers and cerebral vasospasm pointed to a stroke mimic, triggered by her tomato, heavy diet, low sodium, and dehydration. "I thought I was doing everything right," she said. "Tomatoes aren't evil, but eat them sparingly, avoid them at night, and watch for swelling or foggy thinking. If you're on heart or nerve meds, check with your doctor." After hearing about these 9 vegetables, spinach, broccoli, romaine, carrots, garlic, onions, corn, asparagus, and tomatoes, you might feel uneasy. How can foods you've trusted for years turn risky? The answer is simple but powerful. Your body after 65 isn't the same. Your blood vessels are more sensitive, your hydration needs change, and your medications alter how food interacts with your system. Your brain depends on stable blood flow, and foods that thin your blood, spike your sugar, drop your pressure, or dehydrate you can increase your risk of stroke or cognitive decline. But you're not powerless. Awareness is your greatest tool. Simplify your diet with whole foods like cooked greens in moderation, berries, nuts, and hydrating fruits like melon. Eat heavier meals earlier, stay hydrated with a small glass of water before bed, and talk to your doctor about how your diet interacts with your meds. You're not fragile, you're wise, capable of listening to your body and making intentional choices. Take one small step today, maybe move your salad to lunch or check labels for vitamin K. Whatever it is, let it come from strength. You deserve clarity, mobility, and confidence, and with this knowledge, you're already on the path to protecting your brain and your future. If this resonated with you, drop a 1 in the comments and share one thing you'll change. If not, leave a hello to help me improve. Like, share, and subscribe for more tips, and here's to living life on your terms.